Hey, hello, my name is Ethan Gambrill, student physical therapist. I'm here today to discuss the 59-year-old male patient who's post-op day one of an aortic valve replacement. Just to get started, a few precautions related to the surgery I want to be aware of are the sternal precautions with his movements. I want to be on alert for any infections, embolisms, pulmonary complications, things like that, the just general deconditioning he may have. I also want to be aware as there are many lines and tubes as well as cords around this patient. So I want to be prepared for management of those. Getting into a little bit of the vital signs, the heart rate has trended from tachycardic into a normal range. SpO2 was a little low, but is now back within the normal range as well. Respiratory rate is currently at 11, which is a little lower than the normal range of 12 to 20. And it's also still trending down. So I want to be on watch for any sort of shortness of breath or oxygen desaturation relevant to that. Body temperature is also just a smidge high, but is very close to normal level. Blood pressure is still a bit low, especially systolically, and not far from contraindication level of 90 systolic. So we will just want to monitor that through treatment, although it has been trending upward towards a more normal level. Respiratory rate is also slightly low and has continued to trend down, although SpO2 is on a trend up, which may be pointing towards some over-reliance on the current oxygen order. So just want to be watching that. Blood pressure is still low again, but has been trending back to more normal levels. So we aren't overly concerned with that at the moment, but we'll continue to monitor that. I think the treatment would be indicated based on all of these vital signs that I've mentioned. Again, I just want to keep a close eye on that respiratory rate and as well as just be monitoring all other vitals periodically, especially blood pressure as well. Getting into the lab values a little bit. For this patient, hemoglobin was low, as it should be in the 14 to 17 range. So this may be impacting his ability to have good oxygen saturation within the blood, especially since he hasn't been moving. Once we get exercising, that could become an issue. Hematocrit is also below the normal range of 42 to 52%, which could cause some shortness of breath or be contributing to pain during treatment. So we may need a few more breaks spaced in. So just want to be on the lookout for that as we go throughout our treatment. The white blood cell count is also a bit high, has been trending up, which is actually pretty expected post-surgery. And it's not very far above the upper limits of the safe range. So just want to be watching for any sort of potential for developing infection with this patient. Platelets are also within the normal range, but are continuing to trend downward. Just want to keep monitoring that, just make sure this patient does not become a bleeding risk. INR is also out of the expected range for a patient who's also on warfarin, but is right on the edge. So we'll probably be taking a symptoms-based approach with this treatment as it has been trending upward, and they have no prior clotting issues before this surgery. So we'll probably want to check with the doctors and just make sure that everything's okay before we proceed. As far as abnormalities or trends, hemoglobin again is low, hematocrit is low, white blood cell count is high. Again, most of this is expected post-surgery. The patient's lost some blood, things like that. So most of this is expected. The INR again is a little bit low, and we're going to get that addressed. So not sure that that's necessarily unexpected, but everything else I believe is good. Based on all of that, I think that it would be okay to treat this patient, assuming that we receive clearance around the INR value, as we'll just want to be cognizant of the effect of low hemoglobin and hematocrit otherwise, and continue to monitor any other trends that may arise and just be watching for signs and symptoms during the treatment, as patient current disposition could lead to things like that. We also want to, getting into some lines and equipment that this patient has, we just want to generally be avoiding removing any lines without any sort of consent from the rest of the staff or with help from nursing who may be responsible for them. The EKG around the chest may make moving his arms across his body and things like that a little bit more difficult. Chest tube and catheter will need to be kept below the level of insertion. Arterial line may be removed if nursing is able to or willing to. So just want to check with that, making sure not to take any vitals on that side, especially blood pressure. The pulse oximeter shouldn't really be impacting anything if it's just a finger clip. Just want to make sure that doesn't fall off during treatment. The nasal cannula also shouldn't be much of a concern, but will require a portable oxygen tank if we are moving around quite a bit, as well as consideration of the titration parameters around this patient. I don't think any of the current equipment is a problem for us to continue with our evaluation of this patient. As mentioned above, if we could have the arterial line removed, that would be, ideal, but not necessarily the biggest deal going forward in treatment. So for this patient, a couple of things I think that are very important for us to address this first day. I want to assess orthostatic vitals as well as perform a 30-second sit to stand test. For orthostatic vitals, this patient's getting up moving, first time post-surgery, things like that. Decreased respiratory rate at the moment, and low hemoglobin and hematocrit. So just want to be aware of all of those things as well as being on anesthesia. This will help give us a good general set. This will just be important to assess and be monitoring throughout treatment as we make sure this patient is staying stable and not having a significant drop in blood pressure, as were a little bit low to begin with. And also just making sure we don't have any crazy changes in heart rate or anything like that once we actually are up moving a little bit. As far as for the 30-second sit to stand, we're just wanting to do this. We want to get a good assessment of lower extremity function as well as some aerobic capacity with this patient. This will just be a good general assessment and help point us towards some future goals, as well as give us a very good early measure of function, as well as something that we can reach to do better at in the future in future sessions. I think that addressing both orthostatic vitals as well as performing an outcome measure such as the 30-second sit to stand test will be important for assessing during the first session with a deconditioned post-surgical patient with concerns around aerobic capacity, trends in vitals, and need for functional assessment. I think both of these things address a lot for this patient and are very crucial for getting done in the first session. Thank you very much. And do you have any questions for me?